that being done, then we have an agenda or an outline of how there's going to be several presentations on this, and I'll turn that over to our town manager, Christina.
Thank you, Mr. Chairman. So if I could ask four folks to join me up here tonight. I have Chief Bob Sylvia of the Cohasset Fire Department, Chief Bill Quigley of the Cohasset Police Department, Pam Fahey, our Health Director, and Glenn Pratt, the Director of Emergency Management. And you're not on this panel, Casey. You come up here.
Casey's involved in everything. Good evening, Mr. Chairman and members of the board. Thank you very much for this opportunity to do this briefing. As we all know, this situation continually evolves on a daily, if not hourly basis at this point. We didn't see today's press conference coming, so what we'd like to do is we're going to do this in 4 different sections. I'm going to kind of try and update you on how we got started, what we've been up to, and then Pam's going to take a piece, Glenn's going to take a piece, and Chief Quigley's going to take a piece, and we're all going to try and continue the briefing. What I would ask is what we think is the best bet, and if this is with the board agreeing to this, that we'll do this in these 4 pieces, and at the end of each piece, we'll stop. And we'll answer any questions up to that point. And then once we're through, if we haven't, or if we've missed something, or you have additional questions, we're very happy to answer all of them at the end of the meeting. But hopefully through the 4 different presentations, you'll see exactly where we are, what we're up to, and where we're headed in the future. So with that, I guess I will get started. So where are we? We obviously on a daily basis monitor multiple places: the World Health Organization, the CDC, the Mass Department of Public Health, the National Institute of Health, as well as other sites. Some of these sites might be specifically for schools, it might be for other specific things. Chief Quigley and I both chase different things that are specific to our mission. So we do that on a daily basis because our mission is to make sure that we are following the best guidance and giving the people of the town of Cohasset the best practices available. So that's kind of what we do on a pretty much a daily basis and where we are. Along that, just so you have an update of where we started. Well, during January, we started planning for coronavirus. We had our first meeting. It was just starting to break. We had our first meeting, and we sat down and we talked about how could we get ready for this if there were ever to be an outbreak here. And one of the biggest things that came from that was that we ordered supplies and we started planning. Okay? So we were in pretty good stead as of 2 weeks ago when things started to happen. Presently, we have a conference call every single morning at 8 o'clock. The people that are on that, well, I should say, why do we do that? Because we specifically discuss things that have happened in the last 24 hours since we last talked. We are in constant communication, whether it be text, phone, emails, but we guarantee that every morning at 8 o'clock, we sit down and we have that conversation, and it includes the town manager, public health, emergency management, schools, police, fire, elder affairs, and human resources. So we have a discussion every day. As part of that, we talk about our daily message. Now, you've been getting our daily messages and the information that we try to get out. We work very hard to make sure the most recent information is being brought to the public. Today, as an example, what went out was people at risk for serious illness from COVID-19. That was received from the CDC yesterday. That was information they put out yesterday. We put it out to the town of Cohasset today on all of our avenues that we had available to us, whatever the social media fronts were, our websites, whatever. That's an example of what we try to get done on a daily basis. In that effort, we also are doing some other things. We're meeting with staff. So actually today, Michael McMillan and I met with the bus drivers and had in quotes, what we refer to as Coronavirus 101. So we walked them through everything coronavirus. in regards to how is it transmitted, how can they protect themselves, and along that line, also, how can they help us by sanitizing the buses? And we walked through all of that. At the end of that meeting, I think that they were, I've never had a fanfare.
It usually comes.
I don't know how to react to that.
Usually when he enters
Okay?
the room.
This is like the Olympics. So,
Touche.
so we answered, at the end of that meeting, we answered all the questions that they might have, and when they left, I think they were well informed up to the moment. We explained that one of the things that everybody needs to do is stay informed, because this is constantly changing, and there are plenty of opportunities to stay informed. I mean, obviously, the CDC is doing a great job with their website. I can't hammer home that more than that's really one of the big ones. But Mass Department of Public Health also, they're also doing this on an hourly basis to try and make sure that we're all up to speed. Also today, Pam and I met with some of the town hall staff. So we have a meeting today and a meeting tomorrow, so we can meet with all the staff here, because we couldn't close down all the offices at the same time to do this. And we did pretty much the same thing. We answered the question, and we also talked about the CDC guidance for business and employers, so that they have an idea of what they should expect in the building and how they can help themselves and protect themselves, but more importantly, so we could take in the information and bring it back to the meeting tomorrow morning, because they have concerns that may or may not have been addressed. So that's what we were up to. Was that pamphlet handed out to everybody? Did you guys get this electronically? Okay. So that, a lot of the stuff we're gonna talk about, those are on that. Chief Quigley created that pamphlet, and I think it answers a lot of other questions. The last piece I wanna strike on in my part of this is we're also working with Elder Affairs. As you know, through the guidance we're receiving, our elders are our most at-risk population. It's the one that we have our greatest concerns about at this time is our seniors. So yesterday, Nancy LaFosse and I met with the Elder Affairs Board. We talked to them again about Coronavirus 101, what our concerns were, and that was just after that CDC information had started to come out about the elders being the most at risk. After we got through with that, we basically talked about how is coronavirus going to affect operations at the senior center. How would it affect them? So after I left that meeting, Nancy and Mary Goodwin met with first the Friends of Elder Affairs that put on the Monday morning coffees every week. And the folks from Friends of Elder Affairs have decided to cancel the coffees for the rest of the months of March. Overabundance of caution, but as we will constantly say in this presentation, we don't want to put people in harm's way. So by doing this, we're going to not have a group of seniors congregate in any one place. Along that line, the decision was made today to cancel the St. Patrick's Day luncheon, where there were going to be 100 and some odd seniors in one location at one time. Now, we did all of that this morning before what happened today with the press conference happened, when additional thought processes were added. So that's kind of where we started, what we've been up to, and what we continue to do. So at that point, I'll take a deep breath and answer any questions that the board might have.
Okay, any questions from the board here? Diane?
Just a
And
quick
then
question
Carrie.
relating to the elder affairs. And I think one of the toughest things is isolation, obviously, and especially with all the kind of hysteria. And I don't mean that to make fun of the level of anxiety people have. I don't know if Elder Affairs is planning on, some additional visits, or whether we could deliver banana bread to some of the people, but I think I worry with, my own mom just being isolated and not wanting to go out and having that kind of a routine, needing some kind of an extra plan.
Just a quick answer to that is I certainly don't want to put words in Nancy's mouth at this point, but Elder Affairs is looking at everything that they can possibly do. Obviously, they're very proud of the programming that they develop for people, and this is just another challenge for them. And is there a thought process of, can we do things via a video link? Can we do it, we worry about face-to-face meetings because God forbid, somebody trying to do a good thing, bring a bug into somebody's house that shouldn't be there. So I know those things are being discussed and talked about, and this is a very quickly changing piece. The St. Patrick's Day decision was not made until this morning. So where are they gonna be by tomorrow? That's a very good question, and along with Nancy, Mary Goodwin is working hand in hand with Elder Affairs on this stuff, and Pam. So they're working on this, and that is a very, very justifiable concern. What we don't want is that, the socialization of our seniors to cease because. So, yeah, we're definitely talking about
Pass
that.
along, we have
thing
a
on
great
that,
community of,
yeah.
just a
Yeah,
great
the,
community of people willing to help.
The Social Service League stepped up this afternoon, and they're meeting with Nancy tomorrow to see if they can help enhance home visits or whatever she needs, so that's another partner that probably will be helpful in some way.
And to echo what Diane said, please keep us updated with that. A lot of us in the community are concerned about our elders, wondering how we can help. I know a lot of us younger people don't necessarily wanna come in contact with them if we shouldn't be, but people have reached out wanting to know how we can help, so that's really important. I was also just curious for you two especially, how does declaring the state of emergency now affect us as a town? Does that give us additional
So-
resources? What does that mean, I guess, from a municipal town level?
We'll let Glenn speak to that when
Okay.
he gets to that portion of his, as the emergency management director, he can pretty much
Okay.
walk you through those questions.
That's fine.
Any other, yes.
Yeah, I was very interested about the protocol that you might have to, when you spoke to the bus drivers, did you tell them a protocol of how to deal with perhaps children that might have some sign? And if you could share that protocol, and also, how would we let the parents know how to deal with that situation? Because clearly the parents would wanna know what the protocol is, and do the parents have a protocol to report?
So what we met with the bus drivers today was more about the informing them of exactly what coronavirus is, how it's spread, and how they can protect themselves. We didn't speak to the school children per se. That has been the venue that the schools are developing, and the superintendent is honestly working on this 24/7. Each morning he briefs us on what's going on, and he has those site-specific things that he's doing with. He's dealing with psychologists, he's working with best practices. He went to a superintendent's meeting with 19 superintendents, and what did he find out? This was the end of last week. That only 3 of the 19 were really pushing this hard, and we were one of the 3. So he has been way out in front of this from a professional standpoint, and I wouldn't want to attempt to answer the questions on exactly what he's done for instruction with his bus drivers. Our piece of it, or my piece of it, was more just to answer their questions in regards to exactly how this might affect them as employees, and more importantly, how they can help us by continuing the disinfection of the buses, and they're trying to do it twice a day. They're trying to,
Yeah.
now, we all understand that it's almost impossible to clean an entire bus, and that's why we're not talking about cleaning the bus. We're talking about trying to disinfect all the touch surfaces. Now, unfortunately, as we all know, once somebody reinfects that surface, it is what it is, but we are staying out in front of it, and the bus drivers have taken this task on, and they're going to do it after their morning runs and again after their afternoon runs. So the buses should be clean when the children get on them. That's what we're hoping for.
I was kind of interested, is there's a protocol if a bus driver sees a child coughing or sneezing or whatever, is there protocol that the bus driver knows what to look for and how to report that?
That would be a question for the schools and the school committee and the superintendent directly. That would be, I don't think that's one that any of us can possibly answer at this time.
Any other on this section, Paul?
So are there any of the large gatherings that are gonna be in town? The one I come up with is a road race. And the road race is gonna be up in a couple of weeks.
Yeah.
From that size, I would recommend canceling it. That's the sort of thing which we potentially could initiate it as a spread.
We are discussing these. We've created a list of every single one of the events for the next 2 months. We're looking hard at every single one of them. There are some school-based events that are about to happen. There are some town-based events. Do we want to talk about the health and rec
Health
fair?
and rec fair, yeah.
Okay, so one of them being the health and rec fair, and
That should be
at
canceled.
the guidance of all of our professional staff, and that's, you know, obviously Mary Goodwin and Pam, we are going to cancel the health and rec fair. The optics of having a health and rec fair and have somebody get sick were not something we really wanted to deal with. It wasn't a good idea. It just,
Yeah.
It's also-
it was a great idea until,
Right,
You've
It
got
wasn't.
probably, 600 people standing in
yeah,
line.
that's not, yeah.
It'll be indoors, there'll be close contact, it's not 6 feet, 10 minutes, it's gonna be, these are the sorts of exact
to try and
situations which can be prevented.
to try and do the social distancing in an environment like that is just not gonna happen. So obviously, WHO says a meter, CDC says 6 feet, whatever it might be, you need to have your own personal space. And if you're in a shoulder to shoulders and back to the wall, then you can't very well provide that, and we took that into account.
And just to follow up on that, so there's side-order effects of that, so that is a very, let's say, become a central time for families to register their kids for summer programs.
Yeah.
So where Ted has Ted Carroll, our recreation director, has a draft letter ready to go to all the parents to explain the alternative method for that. And the other organizations will be doing similar things, because we can't, I mean, even though the event itself may not
Right.
take place at that site, the activities within it, at least the ones that are reprogrammable, need to, because we need to still be able to register kids for summer programs and all that. So one of the reasons we're being very deliberate about all of this is because we have to think about the next order effects that come from these things. And, you know, this is part of the literally daily deliberation of doing this.
Anything else with the? Okay, second
With
portion.
that, I'm going to pass the baton to Pam, and Pam can fill you in on her piece of this.
Welcome, Pam.
Thank you. So I'm gonna talk about the health department responsibilities, and when I say we, the health department is me, I'm the health director, and Mary Goodwin, who's the public health nurse. So our three main responsibilities that have been and continue to be preparation of planning, education and communication, and tracking and monitoring any close contact cases. So for preparation and planning, we reached out several weeks ago to the Department of Public Health's Emergency Preparedness Group, and they sent 2 members of their staff to meet with us here in Cohasset, and we set up a training exercise. So basically, in I think about 2 Saturdays from now, we'll be running through an emergency medical response exercise, and that's going to happen on March 28th. And then we also ordered supplies in the event of actually specifically for coronavirus. We ordered thermometers, since temperature is the main control indicator, and alcohol wipes and masks. And then in terms of education and communication, last week we were really inundated, as you can imagine. We had people coming into the office, asking questions on the phone, via email, and we answered everybody's questions. And then we also went out into the community. We went to the 2 large apartment complexes. We went to Avalon, and we went to 60 Elm Street to meet with management and any residents and answer questions and gave them recommendations and guidance on what to do. We also visited the library, Park and Rec, Wilco Commons. We brought things like sanitary wipes, and again, spoke to the people that work there, asked them if they had any questions. Then we specifically went to the children's library, and we walked around with the librarian, and we pointed out things to remove, like soft toys that really can't easily be disinfected and stuff, and we had those removed. And Mary does spend a lot of time at Wilcott Commons, just a normal average week, and she's been there a lot and meeting people one-on-one in small groups, and again, giving guidance and answering questions. And then we've been doing a lot of preparation of informational fact sheets, the things that have gone out in the last week or so. And then, so our third major responsibility is the tracking and monitoring, and actually this is Mary's responsibility as a public health nurse. So one of the big pieces of containment for the coronavirus or any kind of virus spread like this is self-quarantining. And there's 2 major categories of quarantining: people that have traveled and people that are actually close contacts to somebody that's either a confirmed or presumptive case. So for travel, there's no one really keeping track of that. There's no one at Logan Airport that's there taking down names when people come in off planes and stuff. So travel is totally, we have to trust people. If somebody's been to Italy or for Japan or South Korea, and they come back, they have to self-quarantine for 14 days. Nobody's knocking on the door to find out if they're doing it or not. So this is like when the community together has to like really trust one another and act cooperatively. And then the other category, it is tracked, it's the close contacts. So, like as you can see what's going on right now with the whole biogen thing. So, if someone is a confirmed or presumptive case, the Department of Public Health calls the local public health nurse. So in our case, they'd call Mary directly and say, there's somebody in your town, here's their name and address and phone number. Mary calls them and lets them know they now have to be self-quarantined. And then she calls them twice a day. And they take their temperature and report it to Mary. And they have to follow the guidelines. And at that point, if you are self-quarantined, you don't actually have the case yourself, your family members are free to go about. But then if you subsequently end up being a confirmed case yourself, now your family members, they have to self-quarantine. So that's the type of thing that we're keeping track of, and DPH has a list, and they're keeping track of who's in quarantine, who's out of quarantine, that type of thing. Once somebody finally, if they are a case, they test 2 times negative in a row, then they're released. And one of the things is the whole communication piece. I know people are looking for transparency and stuff, but one of the issues we've dealt with is, what can we say and what can't we say? We have to walk a fine line because we have to protect people's privacy. And so we've spoken directly with the state, the DPH epidemiologist, and they report cases based on county. So they say, there's a case in Norfolk County, and it's a male, and he's in his 60s. And that's really all we can say. And so we're really actually held by that ourselves. And then eventually at some point it comes out in the media, but technically we're not supposed to say anything. Even when it's good news, even when people are released, we're really not supposed to say anything, and that's one of our issues we're dealing with. But I think overall, it's like everybody seems to be cooperating, people are following all the behavioral things we've been telling them of washing their hands and staying out of crowds and staying home if you're sick. And I think people, for the most part, have been saying self-quarantining if they've come home from Italy. So that's the big thing. Hopefully together we'll stay safe.
Okay, is that it? Okay, questions, Paul?
One of the clear-cut mortality indicators is influenza A, and if you look at the Korean numbers, absolute mortality, 5% is associated with concomitant infection with corona plus influenza A. So if there's any way to push out, if anyone has not had the seasonal flu vaccine, that is a clear preventative measure that would potentially prevent mortality, and it seems to be also very effective in the older population from the point of view of strict all-cause mortality. So I recommend that. A couple of things from the Korean numbers, 90% of people will have symptoms in the first 5 days of their exposure. So, and the German Board of Health discussed once someone is with symptoms, the shedding of the virus is quite extensive in the first 36 hours. So I can't emphasize enough that the quarantine, if someone is self-quarantined and ill, or they get ill, they need to stay quarantined because those are the key hours for potential spread. I suspect that's probably what happened with the biogen, is that they were just starting to shed. There were 170 in the meeting, and there's, I think, 40 or so that are positive. It's a fair number, so it's key to when you're symptomatic, it's truly symptomatic. That's all.
And in terms of the definition of the word quarantine, could you refine that a little bit so it's clear to everybody? Does that mean, so for example, if you lived in an apartment or a house, does that mean don't leave there? Can you go out early in the morning and take a walk or night?
Right.
I mean, just so you could just amplify that for the public and us.
Sure. So when we talk about close contact, in order to be exposed to somebody, usually you have to be within 6 feet of them for 10 minutes or more. So when you quarantine, you really should stay. Well, first of all, if you live in a family, right, and you say you are actually a case, you've been confirmed as a case, you should completely stay away from your family, like be in your bedroom and close the door and stay away from your family as much as possible. If you are somebody that had just been close to a case and you're self-quarantined, you're not actually sick yourself, you should stay in your house. You're not a prisoner, you can go outside in your yard, walk around with your pet or something, but you really should stay out of public places, pretty much stay like in your house, in your yard, and I'd say do your best to really stay in your property as much as possible. I mean, luckily we live in Cohasset where the houses are pretty much spread apart. You know, it's not like a lot of close contact apartment buildings, so hopefully
Okay.
people should be able to abide by that.
Questions, Jack?
By the way, Mary does a wonderful service at the senior center. They really appreciate, you know, her being there. We have a lot of people in town who travel frequently. They are going to conferences, they may be doing a sales call, a presentation, a technical call. Do you have any suggestions that they might, if they're watching, hopefully, to decide when you should go or when you should not go, or any
I
thoughts?
think that's rapidly changing by the day. I think
Yeah.
now that we're in the, you know, the governor's spoken today, I mean, I think they're gonna be, all essential travel is gonna be.
Yeah,
s-
the
not
governor
essential
actually just
travel, so-
suspended travel for all state employees today. And I know that I've talked to some of my friends who travel extensively, and their companies have suspended all of their travel now for the next couple of months. So at the state, and again, we're not traveling either, so,
It's just, that's in other states too, just to clarify, that's travel within the United States is what the governor said, from my understanding.
yeah, so
He
the.
also recommended other organizations may want to follow
Yeah.
what they're doing.
I know that a fair number of places have gone virtual wherever you can. I mean, obviously, you can't virtualize a public meeting in the same sense you can virtualize a conference. But I think the encouragement, at least what I've been seeing, is if you can virtualize it, it's a better plan. And the state's not gonna, all state-sponsored conferences have been suspended. They're gonna go virtual. And again, there's no outside of state travel at this point for employees. Doesn't mean that you can't take personal trips. I mean, I believe the governor's recommendation today was they're recommending no personal travel overseas, and they're recommending no school trips at this point either outside the state. So it's gone from international travel to no travel for school trips anywhere at this point.
Now, at a certain stages, that could be recommended, then if things were to get worse, then the governor can actually, I think he has the authority to require that too. In fact, they're doing stronger things like that, for example, in New York, not that we need it here at this point.
Yeah, what's happening in New York's a little more extreme
Yeah,
than
no, I
what's
understand.
happening here. And hopefully we won't have to reach those.
Right, but those things can occur if it gets worse.
Along that line, you mentioned earlier, or I mentioned earlier, that we are taking our guidance from the CDC. One of the things in the CDC, if you go right in there on the front page, coronavirus comes right up, and then there's different little headers. One of them is airline travel. And it has a complete page and a half to 2 pages of the things, if you do have to travel, the things that you should take into consideration. So there's guidance for travelers, there's obviously guidance for don't get on a cruise ship right now. There's guidance for just about anything. I mean, as emergency responders, there's specific guidance for us. Dr. Schubert is getting specific guidance for healthcare providers. It is specific to each one of our little things, whether you're in the business world, in the school systems, colleges, secondary, whatever. Everybody has their own piece in that CDC, and I can't stress that anymore, that information is power. And the simple fact is that this is out there, it's available to everybody, and it is changing on almost a daily basis. So you really need to pay attention to that and make sure you're up to date with everything that's going on, so you don't put yourself in harm's way.
And other people.
Other people. Correct.
Any other questions on this section? Thank you very
Okay,
much, Dan.
we're gonna let Chief Quigley go next.
So, good evening, everybody.
Welcome, Chief.
So my piece of this is that I've been working with the Regional Dispatch Center and also the other chiefs in the area, trying to get information out. You know, unfortunately, we're the town on the South Shore that has blazed the trail on this, so people are coming to us for answers, and and if I do say so, we're doing a pretty good job with pushing out standard operating procedures and call taking procedures and things like that. So I've been working closely with Shrek and the other chiefs, and they've changed their, the questions that asked, if you called 911 and, needed an ambulance, they'll ask you a series of questions that are apropos now to, if you've traveled out of state, what exactly your symptoms are, and that will drive the local response here. Chief Sylvia's updated his SOPs, and I've updated mine, so.
It's a standard operating procedures,
Yeah,
is what I
sorry.
use acronyms. Some of us don't even know what they are. I happen
So
to know that one.
we have a procedure for everything. I have a procedure on how to enact procedures, literally. But we've changed the way we respond, so if you call, and we get calls all the time for, someone with flu-like symptoms. Previously, you would get a police officer, and, the firefighters, paramedics. Right now, the police officer will still respond, they'll sit outside your house if you're reporting those types of symptoms. If it's not a life, if you're not reporting a life and death situation, and we'll stage for the fire department, we'll let, a minimum number of personnel, maybe one paramedic go in or possibly two. So we're trying to reduce the exposure of the first responders going to a house unnecessarily. So we've come up with a procedure for that, and we're actually getting calls from as far south as New Jersey. People want to know what we're doing, and we're sending that out to them. So our procedure is being used as a model for different parts of the country, which is quite interesting. One of the other things we've been working on, every police department in the state, by law, has an infection control officer. So Officer Paul Wilson is our infection control officer, and he and we, the department, we've been on top of this, like Chief Sylvia said, since early January or mid-January, and we've pre-ordered supplies, so we have a good cachet of masks and gowns and gloves and things of that sort. And Officer Wilson has been pushing out information on how to properly wear the masks, things like that. One of the side issues that come up with the masks, these masks are fitted, and we allow our officers to wear a beard. So I had to be the bad guy last week, and everybody's ordered to shave their beards. So you'll see the officers around with no beards now.
I won't recognize some of them.
Yeah, they look like, it looks like a teenager in a police car. So that's how you tell. One of the other things we've been doing is meeting, having the teleconference every morning. It's been really helpful. We're getting great information. I wish there's great sharing amongst the department heads, and we're able to push out some good information, hopefully. But we wanted to provide some of the information here in this packet, which is really specific local information, what we've been doing, some of the steps we've been taking, and we're working hard at it every day. It's early mornings and late nights, but it's all good. It's worth it.
Thank you.
Okay, questions of the chief?
Thank you.
Just a very quick one on that, as the chief mentioned, and I didn't mention it earlier, and I should have, we have to give credit to South Shore Hospital. We have a medical director at South Shore Hospital that oversees our emergency medicine that we provide to the citizens of Cohasset. And he has given us guidance on exactly how we want to do these things. And one of them was to limit exposure of first responders. Hence, we changed our protocols, Chief Quigley changed his, but we also had those vetted by the emergency medical director to make sure everything that we were doing was not decreasing the level of service that we were providing to a person in need with a medical emergency. So we've received the blessing from our emergency medicine director at South Shore, and we, again, have shared all of that information with the police departments, the fire departments, so that everybody understands what everybody else is doing. And I think it's what we're slowly but surely getting to is the best practices for us as emergency responders. And again, we beat this up on a daily basis to make sure that we're right in line with all the guidelines, and South Shore has done a great job of keeping us also in that same lane, that everybody's getting the service they need, but we're also protecting the first responders with the appropriate PPE for the event that they're responding to.
That's good.
Great.
Do
Paul.
they have face shields?
Yes. And actually, one of the things I'd be remiss if I didn't mention this, the first responders, the officers and the firefighters, have really been great with this. It's, it's a big deal that, tell someone you have to shave and,
Yeah.
you have to work extra, but
That's
they've
rough,
really
yeah.
been on board, and, we're grateful, that
I do
that
wanna
the
say
union
that, yeah,
leadership has been good too in working with us.
and I think from all of us, that those are the first responders that are on the line on getting these calls, especially in an unknown circumstance like this, is something that is very much, I think, on all of our minds, of what they're doing, and just how much appreciation we have for, really almost in situations like this is almost heroic, and, cause it's so new, and they're having to learn and adapt as it is.
Yeah.
But beyond that, I think I also expressed for the board that anything that we as a town can do to help those first responders, or help make it easier on their families, or anything, I think,
Yeah.
speaking to the board, we want you to do that, because we want them to be really well taken care of, and we want it well recognized that we very much appreciate, because first responders are right there on the line, and we're seeing that, and don't want you to think we're not aware of that. We want that supported, okay?
Thank you.
Appreciate that, Mr. Chairman.
Yeah.
Before we go to the next presentation, back to on the Pam on the health thing, do you have any idea of, or when, or if, local testing would be something that will be available even down to the level of a town? And by that, what I mean is that if someone comes down with something, probably one of the things on anybody's mind is, gee, I wish I could get tested quickly and find out whether I have it or not, type thing. Now, I realize that that's a national issue and so forth, but do you have any view on, if that will become eventually something that someone would be able to get a local test from our local health people without having to go to a hospital? Or, I think you understand the question I'm asking. How soon might that get pushed out? And I realize that's a big question nationally, so I don't mean to put you on the spot, but what do you, any comments you have on that, I think?
Did you actually have any
Oh,
comments?
yeah,
I'll
actually,
defer to you on this one.
Yeah. So I spoke to the CDC on Thursday morning, a call, and one of their pandemic team members, they shipped 100,000 testing kits as of Saturday morning across the country. Another 100,000 went out Monday morning. They're looking at about another 500,000 within the next week or so. They're trying to ramp up the testing. As of now, the testing is the limiting factor for, to be honest, we can swab at South Shore, we cannot test locally at South Shore. This has been a concern of a lot of the healthcare workers there, is that being able to screen them immediately is delayed 48 hours at the state level. There is just not enough on-site testing. We can do influenza A, we can do influenza B, we can do a kind of a panel of parainfluenza A and B and a few other viral titers, which will take 12 hours at the most. But right now, the on-site testing. So this goes back to self-quarantine. You need to look at exposure. You need to look at where you've traveled. Please, if you are sick, call ahead, let the ER know so they can triage you appropriately. It seems to be relatively contagious, as we saw from the Biogen, and if it's a concomitant infection, we typically right now are screening if it's influenza A, they're in isolation, but there's a level of concern above that if it's influenza A with a coronavirus, which is going to be a concern. So that's
Mr. Chairman, if we could also pick up on that very, very quickly, and that is that the CDC has recommendations for those that are going to be tested. And right now, it's people that have traveled or people that have been in direct contact with somebody that is a presumptive case, and then somebody that is sent by their primary care physician or has spoken to a hospital to come in and be tested. What they don't want is what Dr. Schubert mentioned, people showing up at the door saying, I want to be tested for coronavirus. So they're trying to get that information out into the public also. So there's priority one, really at this point, because it's starting to explode because of Biogen, that you've been in the contact and you're being watched because of you've been in contact with a presumptive case. Two, that you've traveled, and mostly from South Korea, China, or Japan, Italy, and then Japan to a piece. or Iran, but I don't see a lot of travel from Iran, but those are the ones that they want to get tested. And then past that is if you think you have the symptoms of this, then you should call your primary care first. Don't just walk into a doctor's office, would have a situation like happened in Norwell, or don't just walk into the hospital and do the same thing. So, that's kind of the message that needs to get out to the public in that regard. Not everybody that has a fever and a cough and a little difficulty breathing is going to get tested for coronavirus. And most of the folks, fortunately, that are being tested for coronavirus, even those that are being found to be positive, where are they going? Home. For chicken soup, fluids, bed rest, and I would say binge watching on Netflix. I mean, you're just gonna go home and get well.
Yeah.
Unless you develop further symptoms, and that's when our people get in the middle of this mix. And that is, okay, you've been home, you have some slight symptoms. If it progresses, make a phone call 911. We'll come, we'll take you to the hospital, and even if we're going to take you to the hospital, as Dr. Schubert mentioned, we're calling in advance. We are not showing up at the door at the hospital with somebody that could possibly be infected with coronavirus and then nuking the emergency room. That's not what we're going to do. So that's just kind of a quick answer to that.
No, that's good, that's very helpful. Anything else?
Nope.
Okay,
Glenn.
Glenn,
The
welcome.
emergency management side,
It's Glenn Pratt, so just so.
Glenn Pratt, Emergency Management Director. Our responsibility is to coordinate and help any of the town agencies that are responding to the incident. So the first thing we did Monday morning was get in touch with MEMA, Massachusetts Emergency Management. At that time was on standby because it was still being led by the Department of Public Health. And throughout the week, they've gotten more active. The state of emergency, which was declared today, is a big step for the state. It gives the governor broad authority to, number one, put MEMA in charge of the incident, because they're the only folks that can go into the national stockpiles and get supplies and things. There are certain issues with activating the National Guard to get on the state of emergency. So this basically is a good thing for the state level. As of 6 o'clock when I came here tonight, talking with MEMA, no cities and towns have declared a state of emergency down the next level. So I don't think that's something we have to be concerned about just now. So in our coordinating and supporting the other departments, Monday morning it was decided that we would get a sanitizer program in place and start a program of one standardized sanitizer throughout the buildings. We found that, and it's fortunately a local manufacturer, so we think the supply chain will stay easy for us. By midweek, we had all of the custodians in the town buildings and the cleaning contractors that work in some of the buildings trained, and they in fact are using materials supplied by the town. This is not cleaning. We didn't train them on cleaning. We trained them on sanitizing, which is a much different process. A lot of times in cleaning, it's an old expression, you clean with your eyes. If it ain't dirty, you don't do anything. Sanitizing is different. You gotta touch every surface that you're responsible for sanitizing. So that is in place. We have installed just a shade over 50 hand sanitizer dispensers in town buildings. There's another probably 40 going in the school buildings, but it's a fairly slow process. So that by the end of the week, there'll be at least 100 sanitizers in public spaces, town buildings. And each of the occupants, the department heads of the buildings are working with Mary Goodwin in the health department and in turn the custodians on what surfaces they think are most important, what frequencies, and how they'll sanitize those. As the chief has said, the bus drivers are on board. They should be in full swing tomorrow, sanitizing the buses. We began to increase our stocks of personal protective equipment, which is getting harder and harder to get. We've had a large supply of PPE up at our Emergency Operations Center. And I was looking at some of the shipping labels on some of the boxes, and I dug them out earlier in the week. They were shipped to us in 2006. They're not, something perishable, like a soup, but we've had them for a while. And So we're increasing those now. We've also asked every town department and some of the department heads to let us know what they have for a little stash of cleaning supplies and wipes and sanitizers and things in their buildings. So we wanna see how we're gonna try to consolidate that stuff so that we can conserve it, number one, and know what we have on hand. And I believe Board of Health and HR is coming up a little bit of a protocol for the town employees that are public facing, the tax collector, the building inspector, people like that, how they'll do that. The other part of our responsibility for emergency management is manpower, and so our manpower organization is called CERT, Community Emergency Response Team. Over the last 8 years, we've trained up 45 people. We have personally reached out and called every single one of them today, this week, so 30 of them are still on board and ready to go. We've let them know that they might possibly be deployed. That's why we had the call. We are going to schedule as soon as we can, as soon as we get enough volunteers, run another CERT training class. And we also had developed last year, and we hadn't got it off the ground yet, but this will be the impetus to do it, is we're gonna also train a group of volunteers, mostly the volunteers that work in and around the senior center, give them a little training just specific to the things we do at the senior center and for the seniors when we open that place as a warming center and whatnot. And so, Mr. Chairman, since you like acronyms, we're calling them the CAST, Cohasset Assisting Seniors Team. So those things will be getting underway hopefully in the next couple of weeks. So what can the public do? One of the things that is helpful is go on the town website, go to the Code Red, which is the mass notification system, and update your phone numbers or any information that you want us to know about you so we can be in touch. Volunteer, go onto the Cohasset Emergency Management website and send us your name and address and phone number, and I know phone number's old school, but we'll get a hold of you. For our research teams, check on your neighbors, make sure you know what's going on around, which is something that we always try to drive home in the winter storms and when there's no power through the outreach. Don't hoard things. Don't hoard things that you don't need, because we may need them. Somebody may need them. And the other thing is just stay informed. And as we said, every morning we talk about how do we get the word out. I think the chief will tell you that some days over 10,000 people click on the police Facebook page. So it's, probably getting to that segment. On the 143 TV, there's a constant scroll at the bottom of the screen with a lot of this information that we've been sending out. Today, I think it was PM and Nancy LaFosse. It was very good when Nancy LaFosse, the senior center, they were filmed in a little chat conversation updating folks on the situation, which will be broadcast tomorrow, I think, on 143 TV. So those are the things we think are getting out there, but we never know if we did everybody, unfortunately. So
And wash your hands. That's probably the easiest thing to put out.
Since when is that a thing?
Sanitizing is fine, but even more effective is soap and water. Wash for 20 seconds with warm water and hot water, and that will break the chain. A lot of it is hand to hand, sneezing on it, touching, and that's where they'll touch the face, you'll touch the mouth. Because contact, the contact is that way. So washing your hands is the cheapest, easiest, safest, cleanest way to do it.
just a little off topic, but what makes soap so effective at doing that?
Well, it's a detergent, so it's a little bit basic, so it will actually dissolve into the corona and any virus envelope, and will actually break it down, so it'll tear it apart. Temperature will do it as well. Sunlight will do it as well, so outdoors and UV light will kill it. That's why you typically see in the seasonal flu
Yeah.
outbreaks, you'll see as the weather gets better, people are less indoors, there's less large groups at schools, and the temperature's better, so more people are outside, and that change of person-to-person transmission is a longer length, and will die outside.
Diane?
I just have a general question, which I was surprised the governor didn't cover today, which is general municipal operations and how those could potentially get impacted. So we don't have town meeting until May 4th, but a lot of towns do. We have a obligation to pass budget, so I just wonder what steps we can take now, should we get to a point where holding a town meeting, convening a town meeting, which we have to do in person by law, is an issue, and what options might we have?
So I actually spoke with the clerk about that today, because she was actually contacted, because a lot of clerks have contacted, so the Secretary of State's office, the Elections Division communicated back and saying, at the moment, there isn't much you can do, because the state law is so locked in. And I did talk to Town Council Durensis last week about this too. There is an effort being made at the state level to amend the law to allow more flexibility to reschedule a town meeting, because once it's locked in place, you can only adjourn it, you can't stop it. Even for a blizzard or something, that's happened before, in other places. And town meeting season has begun, I mean, it's March. So we're gonna see how this plays out. In theory, you could push a town meeting as late as June 30th, some communities do. I was also told there's another provision where you can kind of work, what happens at the state level, they pass what amounts to emergency budget, there's a default, there may be a default 1/12 of last year's budget will go month to month. Not a terribly effective way to govern, but if you had to do something on an interim basis, we're gonna have to wait for more action from the state on that.
Do you know whether the governor has the authority to do that through a state of emergency declaration?
Well, there was one thing he said today that I think might have been part of it, was the Department of Education said that from now until the end of school, absenteeism data is
I
not
saw that.
valid. So
Yeah.
I think that was probably under some of the powers that he has.
Yeah, and that would, that would waive the ability, there's a maximum number of days, a minimum number of days kids have to be in school. I think that this is unquestionably an issue, because there's, 300 towns in Massachusetts, and we all have the same basic issue, so, and this is town meeting season, I mean, it peaks in April and May, but this is town meeting season. So we expect some action. I actually haven't reached out to the MMA, but I could, and find out what they're doing.
I have my
That's
board
business.
meeting tomorrow, so
Okay. Well,
with
you
Jeff
can ask.
Beckwith, I'm anxious to hear his take.
You can ask directly, but it is something we've talked about. I mean, fortunately, we have a fair amount of time, and all of the meetings leading up to town meeting are gonna still happen this meeting. One thing that we are going to, that I would recommend we do, is we move our meetings to the senior center. One of the points of, we still have to have public meetings, you can't not have a public meeting. Just to get more room, no, literally, it's more elbow room to give,
Yeah.
and it's better air circulation, it's a bigger room, so. We were gonna be there next week anyway, so I would recommend that we stay there for the time being.
I think
Talk
we'll
to
probably
Kevin
do
about
that
this.
unless the board is objective, so yes, that's what we're planning to do.
And it does mean we'll have to clean the room at night before it reopens, which is fine. We've talked to facilities about doing that, so that would be next week, the week after, and
The rest of our
for the
meetings will
foreseeable-
have it.
the foreseeable future. And we'll try to give everybody a little more elbow room. And there'll be hand sanitizers all over that building tonight.
Okay, anything else? Anything else? Anything else at all? And just one final transparency piece, if there's anybody in the public who would like to ask a brief question, we would allow that as well. And I hear one, yes, identify yourself, please.
Meg Wheeler, 114 Forest. So this has been asked a couple of times, but I just want to ask it again to be clear. I know a lot of people I've talked to want to help. How can we help? Since it does seem like we're limited in what we can do, and maybe the answer is we can't, but how can we help?
Well, I think Glenn had, so, let Glenn.
We're trying to gather all the volunteer information through the emergency management
I just signed up.
email, yeah. So we may not be back to you right away, but
That's
we'll be
okay.
assembling the list of help. Thank you.
Yeah, anyone who's interested, if you could sign up on that emergency management, the page and get your information. And there may be a need for CERT, there may be a need for this cast. We might need people to help deliver food. I mean, there's 1,000 things that we can end up needing, and your volunteer time could be very, very valuable. And that's one of the great. So I just wanted to thank the board for all your support in all of this, all your work to push out the messages we've been pushing out. It's really important that we speak with one voice and that the community's hearing a clear message, and that people feel that they're, I had people stop me in the parking lot, just as Pam was saying, I last week, and I was talking to folks, I ended up on TV unplanned last week. It's important that people know that we're doing everything we can, and I really appreciate all the work that not only the 4 folks here, but all of our staff members doing every single day, from first responders to the teachers to the folks in our tax office, public works, and everywhere else, to keep things going. We had 5 meetings last night in this building, and this building's still heavily used. And this is our busiest time of year, so we're gonna have to just, accommodate and do the best we can and be safe, because there's a lot of business to do. But with this community and its strength, I think we'll be okay.
Yeah, okay, anything else? Yes, Paul?
And the CDC did recommend no air travel for anyone 60 years of age and older unless it's absolutely necessary. And, don't take a boat, I don't know if you take a boat anymore, but the air travel thing was out, I believe, yesterday morning. 60 years of age and older, that's where the significant rise in mortality begins at the age of 60, and it asymptotically rises over the age of 80. So the people who are going to be very, very, open to this infection, older people and pregnant women. It looks as if the younger people don't seem to have a mortality, at least out of the Korean numbers. So they seem to be the carriers of the disease, and they may have some relative immunity that may be cross-reacting with other coronaviruses they may have been exposed to. But over 60, just don't travel at this point.
Okay, anything else? To the board, what Chris and I had chatted, and what we're gonna do is that each of our meetings going forward, under Chris's update, he'll give us an update, as to where we are. We won't necessarily have to have a big meeting like this unless something, it becomes appropriate, which we're not anticipating particularly in the near future. But that's the way we'll be posted, going forward, okay?
Great.
I really would like to thank very
Thank
much
you so
all of
much.
you for the work.